This is my IV infusion video. So I'm going to do my 6 rights, which is the right medication, right dose, right patient, right time, right documentation, and right route. And then his name is IV needed, and he's admitted for rehydration and antibiotic therapy, and he needs IV NS 0.9, 1,000 ml bag, and to infuse over 6 hours. So I would label this with the patient's name, date, my own initials, the infusion rate, and the time that it would start, which is at 8, and end, which is at 1400. So I'm going to get my tubing, and I would check them all. Make sure the orders are still in there. I'm going to spike it. And I make sure my clamp is closed. Then I would take this to the patient's room. Sorry. And I would walk in the room, wash my hands, introduce myself, and then have the patient tell me his name and date of birth, which would be the 2 identifiers, and his name's IV needed. And so then I would explain to him what's going to happen, and he has an allergy to latex, so I'm going to use non-latex gloves for the procedures. And I would tell him that he has an IV ordered for 0.9 NS 1,000 mLs to infuse over 6 hours. So the ml per hour, I would put an absorbent pad on, and then the ml per hour would be 166.7, which is about 28 drips per minute and 7 for 15 seconds. So I'm going to hang my IV tubing. You need to fill the tubing so there's no bubbles. Okay. And I would set my drip factor to, or I would just let that be for now. And I'd wash my hands, I'd put non-latex gloves on, and I would tell him I'm going to start his IV. So I'd put the tourniquet on and see if I could feel, when I had it on, see if I could feel a radial pulse. And if I couldn't, I would need to take the tourniquet off, reapply it, and looser, not so tight. And so I found a pulse, so I'm going to release that. And I'm going to wash my hands, put gloves on, clean the IV site. And I'm going to put the tourniquet back on. I have my gloves on. I'm going to get all my stuff set up so it's ready. I would have gloves on, and I'm using a 20 gauge needle. So I would have the bevel up, and I'd fill for the IV, the vein. And I found one. So I'm just going to insert, bevel up, pull the skin tight, insert, bevel up, and then even out. And take my needle out. And then I got flashback, so I'm going to take the tourniquet off. And I would throw this in the sharps. Put my IV bore on, and then my saline, and I'm going to insert 5 mLs. And I'm going to place this on to secure it. And then I'm going to clean the site to get rid of any blood or anything that would have been on there. I'm going to put gauze under it for comfort. And I'm going to place I'm going to write the date and my initials on this so they knew when it was put on, and then I'm going to place it on the IV, making sure not to cover the whole thing so you can take the and there's that. Then I would clean the IV site, the bore. And I'm going to put a piece of tape over this to make sure it's secure. And then I would get another piece of an alcohol wipe to clean this. And I'm going to tape this so it's comfortable. And then I'm going to set my drip factor to 15 or 7 drips for 15 seconds. Because then that would even out to 1 or 28 per minute. And then I would go document everything I did, how we tolerated it, clean up my area, and get rid of my garbage. And I document and I'd assess to make sure his IV was infusing. And I document that he tolerated it well and that the IV is infusing at the rate we needed. And that's it.